Good morning. It's good to see all of you here this morning, but truth be told, I really can't see most of you from up here, but I'm glad you're with us today. I'm Amy Niles, I'm Chief Mission Officer with the PAN Foundation, and before we begin this morning, I'd like to ask Phyllis and Lori to briefly introduce themselves. Phyllis?
Good morning, my name is Phyllis Bass, and I am from Cypress, Texas, a big metropolis right outside of Houston. Yay, Texas! And I am a patient, and I am also a PAN recipient.
Hi everyone, I'm Lori Hall. I am the Vice President of Health Literacy and Communication Strategies at a small consulting firm called Legacy Health Strategies. We're a tiny consultancy made up of pharma expats who have a tremendous passion for patient engagement, and so we consult back into research and development to ensure the patient voice is represented at every step of the way.
Thank you so much, Lori and Phyllis. For those of you who are not familiar with the PAN Foundation, we are a national charitable foundation and healthcare advocacy organization, and we are here to accelerate access to care. We do that through three pillars. One is financial assistance, which I think many of you are familiar with. Through about 80 different programs, we are able to provide financial assistance to people who are underinsured to make sure they can afford their out-of-pocket costs for their treatment. We also advocate for patient-centric policy solutions to improve access to care, and along the way, we do a lot of education, patients and healthcare providers. We have long been committed to the issues of Medicare reform. We advocated for more than a decade for the Medicare reforms that were passed as part of the Inflation Reduction Act, the IRA, just about 2 years ago, and now we're turning our attention to educating patients, healthcare providers, patient advocates like yourselves about these reforms. We are all advocates, we are all educators, and I believe we all have a commitment and an obligation to educate the patients we serve about two very important reforms that are coming our way in a matter of a few months: the Medicare Part D cap and the Medicare Prescription Payment Plan. As we have heard during this conference, the Medicare Prescription Payment Plan is not so simple. We were hoping as it got designed that it would be a lot more simple, but it is actually complicated. So it's going to require a lot of education on our part. We know that 2025 is likely going to be a rocky year in terms of implementation, but we're committed to moving forward, and hopefully by the end of 2025, we will have learned a lot. So today we're going to go into some detail about the Medicare Part D cap and prescription payment plan. I know this may be a repeat for some of you, but I think repetition is good. But importantly, we're going to turn our conversation to health literacy, health equity, and how best to communicate about these reforms to the patients we serve. So there were 6 Medicare reforms that were passed as part of the Inflation Reduction Act. We won't go through all of them today, but the Medicare Part D cap and the Medicare Prescription Payment Plan, I really wish they had come up with an easier name or an acronym that just flows off our mouths, but they didn't. Those 2 reforms get implemented January 1st, 2025. At panfoundation.org, we have created a Medicare Reforms Hub that I hope you are familiar with or will become familiar with. We will be updating the Hub over the next few weeks, preparing for open enrollment, which begins October 15th, and importantly, preparing for a national Medicare reforms campaign that we will be launching at PAN. And when we do so, we will have resources in English and Spanish about these two reforms, both in print, online, and videos that all of you will have access to and can use with the patients that you serve. So let's dive in first with the Medicare Part D cap. This is probably the easiest reform to describe. In 2025, there will be a hard cap of $2,000 for people on Medicare Part D, both standalone plans and Medicare Advantage prescription drug plans. People on those plans will not pay any more than $2,000 for their prescription medications. All the drugs that are included in the Part D program will be included in the cap. And who will the Medicare Part D cap help? Well, it's going to help everyone, but in particular, as we all know, it's going to help people who historically have paid a lot of money out of pocket for their prescription medications. What will patients need to do to benefit from the Medicare Part D cap? Nothing at all. It is automatic. There are no eligibility requirements to benefit from the Medicare Part D cap. And how will they pay for their prescription medications with the cap? They'll pay for them like they do now at the pharmacy counter, unless they opt in to the Medicare prescription payment plan. So by law, according to the Inflation Reduction Act, come 2025, all Part D plans must offer the opportunity to their enrollees to opt into a program called the Medicare Prescription Payment Plan. And this will allow them to spread their costs for their prescription medications over the calendar year. Now, who will this benefit? We've learned that individuals who have experienced, for example, $2,000 or more in out-of-pocket costs for the first 9 months of the year will likely benefit from this. Or maybe they have a prescription fill of $600, the threshold that CMS has put forth. They may benefit as well. If someone is not eligible for a program like the Federal Extra Help Program, also called the Low Income Subsidy Program, they may benefit from this program. The Extra Help Program is a federal program that unfortunately millions of eligible individuals are not aware of. And so that is something that I think we all have a responsibility to do, because if someone is eligible for the Extra Help, which means they have very low income, very low assets, they're going to pay very little in out-of-pocket costs for their prescription medication. So it's important that patients know about that, and if they are eligible and apply and enroll in that program, they likely do not need the Medicare prescription payment plan. Similarly, if they can get a grant to cover their out-of-pocket costs from foundations like PAN or HealthWell or the Patient Advocate Foundation, they may not need this program as well. However, regardless of one's out-of-pocket costs, any patient who is enrolled in a Part D plan can choose to opt into this program. And they're going to do so by opting in directly with their healthcare plan. They're going to call their plan, the number's on the back of their insurance card, or they're going to go onto their website to start that process. And beginning with open enrollment, the plans are going to have information about the Medicare prescription payment plan on their websites. So this is a change for patients. They need to take action to opt into this program. It's not automatic. What will patients' costs look like month to month? It's going to be variable. So I have a very simple example, and this is simple because patients may have very complicated scenarios, but let's say Mary opts into the Medicare prescription payment plan at the beginning of the year. She doesn't have any costs in January, but in February, she has costs of about $1,030. So what is that going to look like for the rest of the year? Well, we have formulas that the plans are going to use. And in this case, that formula looks like $1,030 plus what she incurred in January, which is 0, so we're still at $1,030, divided by the remaining months of the year, which includes February, and that's 11. So $1,030 divided by 11 is about $94 a month. It's going to change if people have new prescriptions to fill or refills. That amount is going to fluctuate from one month to the next. And that's a hard concept to explain to patients. But what we know is by the time that patient gets to the end of the year, they will not have spent more than $2,000 because of the cap. How will they pay for their medications? This is a change. They're not paying at the pharmacy counter. They're going to get a bill from their Part D plan. So now patients are getting 2 bills a month: their premium for their Part D plan and their prescription bill. We're advising patients that if they have affordability issues, they should pay for their premium first to make sure they don't lose that coverage. What if payments are missed? And this is going to happen. Life happens. There's going to be a due date on the bill that's provided by the Part D plan. If that due date is missed, they'll get a reminder. But if they don't pay within 2 months of that due date, that plan can kick them off of the Medicare prescription payment plan. They can't kick them off of the Part D plan, but they can kick them off of the payment plan. That patient can always opt in again, but they have to make sure that they have paid their outstanding balance. The payment plan is something that everyone is going to opt in every year. And if you move from one plan to the next, you have to opt in again. Can patients leave if they don't like the plan anymore? Yes, they can do that. They'll need to pay their outstanding balance. So you see, it's complicated, there's nuance to it, and I think educating patients will be a challenge. So just a few notes on the differences between the Medicare Part D cap and the Medicare prescription payment plan. Does the reform lower one's costs? Well, the Part D cap does, especially for people who have experienced high out-of-pocket costs. Now they'll only pay $2,000. But the Medicare prescription payment plan doesn't lower anyone's costs. It just makes them more affordable because now the patient can spread it out over many months. Who's eligible? The Part D cap applies to anyone with a Part D plan or prescription drug coverage. And for the Medicare prescription payment plan, it's a mouthful, anyone enrolled in that Part D plan can opt into that program. What do patients need to benefit with the Part D cap? Nothing. It's automatic. No one needs to do anything. But with the Medicare prescription payment plan, that patient needs to get in touch with their plan to opt in. How will they pay for their meds? With the Medicare Part D cap, they'll continue to pay at the pharmacy counter unless they opt into the payment plan, in which case they're going to pay their plan monthly for their costs. So we know that a lot of education is going to be needed from all of us. A couple months ago, the PAN Foundation, through our Center for Patient Research, did a national poll of Medicare beneficiaries to assess knowledge of these two reforms. And we kind of knew going in what the results were going to be, and it turned out exactly as we thought. First of all, and probably to no surprise to anyone in this room, we found that 1 out of 4 Medicare beneficiaries at least are having trouble paying for their medications, and they're looking for ways to alleviate those costs. That's probably not a surprise to anyone. But when it comes to awareness of these two reforms, most people are simply not aware that these reforms are coming, especially the Medicare prescription payment plan. I think there's some talk around the Medicare Part D cap, but usually you don't see any conversation or discussion around the payment plan. But that said, everyone wants to learn more. A lot of people want to learn more. And that's where all of us come in. And all of us have a job to do in terms of educating patients about these two reforms. So, let's talk about the strategies that we can implement. Lori, I'm going to start with you. From a health literacy and health equity perspective, what do you think we need to be thinking about as patient advocates when we are educating patients about these reforms that are coming?
I think I'd start with excuse me, the acknowledgement of how important language is to understanding these reforms, but to understand health and healthcare in general. Language is integral. And all too often, we assume people understand the information we give to them and then wonder, why are they not taking medicines as prescribed or following their treatment plan or following up with their physician? So don't underestimate the power of words. Words matter. And I really believe that when we speak clearly and meet people where they are, there's this magic that happens where I think each of us as humans want to understand and feel understood. And so if we're working with patients and meeting them where they are, using language that is meaningful to them, we're translating that highly technical medical insurance jargon into what we call plain living room language. And that alone has such great impact because then people aren't using all of their cognitive energy just to understand the words on the page. So I'll start with that, and as we start to communicate a little bit more and have our conversation, I'll give you some really interesting tips and tools to start to think about how we communicate effectively with the patients that we're serving.
Thank you. Phyllis, I know you have something to add to that, and I'd just like to ask you as an individual whether come January 1st or in the coming months, you are going to sign up for the Medicare prescription payment plan.
I will sign up for the plan, and the reason is because I live with multiple diseases and use, of course, a lot of medication, expensive medicines. I live on a budget like a lot of Medicare recipients, and so having the option to spread my payments out over months would be a great help to my budget, and for that reason, it would really be a godsend to me and to other Medicare recipients as well, I do believe.
Thank you. So there are at least 1 million, 2 million individuals in this country who we know will definitely benefit from the Medicare prescription payment plan. Reaching those patients, reaching various communities can be a challenge. So I'm wondering if each of you can share your thoughts about how collectively we can reach the communities that need this information the most.
I can take the first stab and then we'll pass it over to Phyllis. I think the first is just breaking through the noise. In this age of information overload, there's just so much hitting us. So to be able to break through that so that folks who would be positively impacted through these reforms recognize, oh, that's me. A punchy headline, something that grabs people, that helps them recognize for themselves this applies to me, I need to read more. So that's incredibly important. If you're talking about written communication, there are a number of tips and tricks and tools, all evidence-based. I should probably define what health literacy is. It's personal health literacy is the ability of an individual to obtain, process, and act upon information so they can make informed decisions. So that that first piece, obtain, is incredibly important. The rest can't follow unless they have access to the reforms that actually can positively benefit them. So utilize the channels that you already know are in place, the communities where do community members go for support, for information, for guidance? Public libraries, churches, barbershops. There are a number of ways to get really, really creative in reaching people. From another aspect of written communication, it's not just reading grade level. Many of you probably know there's a handy tool on Word called the Flesch-Kincaid model. It's not a bad first pass, but there's so much more than reading grade level that makes content relatable. It's about is the content applicable to the audience you're trying to reach? Does the headline grab them and help them understand what this is about? Information design is incredibly important. So really stay away from giant walls of text and really leverage white space and bulleted lists where you can, particularly because there are enrollment requirements for the plan that Amy just described. Use the step-by-step process rather than just a bulleted list. Help people understand what they need to know and what they need to do. Step 1, do this. Step 2, do that. If you're using imagery, make sure that the images support the text and the text support the images. There's nothing worse than those sort of slick magazine photos of really happy people doing things that none of us ever do, and are so not relatable. So choose wisely the photographs you're using, the images that you're using. If it doesn't support the text, it doesn't belong there. Cultural relevance is incredibly important. So if you're using examples, if you're using names, if you're using descriptors, make sure that it represents the audience that you are communicating with. So if we just heard in the previous panel the importance of translation, and it's not just translating the words, but also cultural adaptation so that it actually hits home and is meaningful for that particular community. So those are just a few of the written principles of good communication. I will direct you to the CDC has a wonderful well thought out website. If you Google CDC health literacy, you will be presented with a wealth of information to help you get started and help sort of take your learning to the next level based on just some of the things that I shared with you today.
Phyllis, what are your thoughts in terms of reaching communities?
I think that one of the best ways, I'm an internet person, and I believe that reaching or seeking information, especially information in regards to Medicare reform, people need to really go to the source. Medicare.gov is probably the best resource that a person can obtain information. However, the information on that on their website is not for everyone to read. It can be a little difficult to digest depending upon your education level, and so there are advocates sites such as PANS And they take Medicare's message and simplify it and make it more digestible to most readers and update their information as needed so that you're getting the most relevant information in the easiest form to read. So I do dissuade people from going on Facebook and, getting misinformation from other sources. But just, try and stick with those tried and true sites. And also, it's not just PAN that is producing these great sites with simplified messages. There are other advocate sites out there, and patient advocates also need to, spread the word. I believe in the phrase, each one teach one. So if there is information out there that that will benefit the communities that are in need of this information, share it. Just share it with everyone so that, everyone will be in the know.
That's great. I know at the PAN Foundation, we're doing all we can to collaborate with other national organizations, community-based organizations, to do webinars. We're going into communities across the country to do this education. It takes a lot of time, but these reforms are really important for Medicare beneficiaries. So I hope all of you will be committed to this education. I do worry a little bit about the Medicare prescription payment plan because of its complexity and how to message this really well. So Lori, I was wondering if you can help me with that, and if you have any specific strategies that could help all of us as we are trying to communicate as simply as possible to the patients, not to tell them what to do, but to give them the information so that they can make the best decision for themselves.
Absolutely. I've already shared a little bit about what's important for written communication, but I think we should not underestimate the power of verbal communication as well. And what I know to be true is that you can have the right message and the wrong messenger. You are the right messengers. The trust is already there. Don't underestimate the power you already have with patients. So that's already taking things to the next level. That building trust and maintaining trust over time is incredibly important. What I would say is some of the things I'm sharing now are universal to anything you might be working with patients on, but I can't imagine it any more important than these reforms. But I think a good starting point for verbal communication is to ask the question, what is your understanding of? What is your understanding of the new reforms coming out? And what's so interesting about that is it doesn't assume anything. It's that I sincerely want to work with you and understand your perspective. And let's start with where I'm meeting you where you are. What's important to you? What is your understanding of? And that simple question will give you a wealth of information on where to go next. So then it's, if what you're hearing back is complete and it's accurate, then keep going and through your teaching of the steps to navigate these new reforms. If there is something incomplete or wrong, don't add anything more until you've clarified that. At the back end, there's this concept called teach back that is also quite powerful. And I'm a nurse by training, and so some of the ways that I've used this, particularly with men for some reason, of sort of, I know what's going to happen. You know when you go home, the first thing your wife's going to ask you is, what happened at the appointment? So to make sure that you're prepared to answer those questions she has, let's practice a little bit. Share back with me your understanding of what we talked about. And the idea here is not quizzing the patient. It really is taking the onus on us as communicators, as healthcare providers, as advocates, that it's our job to communicate clearly. So it's important that it's framed in that way. So Teachback is another powerful, powerful tool. The other thing I would say is to chunk things over time. Resist the temptation to give lots of background or lots of more context than is needed. Keep it as clean and clear and crisp as possible. Chunking is a very effective tool for helping to introduce new information. It's very much known in the adult learning principles that oftentimes we know that 20% of the content is all that's necessary to act on, 80%. And so really testing yourself to make sure that you are providing what's in it for me. The WIFM is really important so that people actually take notice, that you've communicated in clear, simple terms, that perhaps you've used the CDC health literacy website. There's actually also a tool on there. It's called the Clear Communication Index. And what that does is it helps you assess your content for health literacy best practices. Another handy tip or tool is using, there are several medical related glossaries out there, but I find there's one called Just Plain Clear. It's a glossary that is sponsored by United Health. The vice president of health literacy happens to have the person who set that up was a mentor of mine, and he was dedicated to providing clear communication in terms for all of the the jargon that we use in health and healthcare. It's a handy tool. Keep it handy. And then one last thing I will mention as well. In this age of AI and wondering how this impacts us, I've been using ChatGPT to help me make content more understandable. But it's incredibly important that the prompt that you give is an accurate one. So what I've tended to do, if I've got some content that isn't exactly what I want it to be, it feels too complicated, excuse me, I will give the prompt following the Clear Communication Index, review the following content, and rewrite into plain living room language for the Medicare population, something like that. And it's amazing what you'll get back, but it's important that you reference a reliable, evidence-based tool like the Clear Communication Index. But these tools make your job so much easier and will help accelerate. Rarely is the first draft of the response something I use. I need to sort of craft it and take some of those other considerations, other things into consideration. But it's all about getting as far as you can, doing what you can to accelerate the process to clear communication, and that's a handy tool as well.
Thank you. Phyllis, I'll ask you, I know you are well-versed in the Medicare prescription payment plan, but when you think about what it's all about, the nuances, the steps patients need to take, what are the top 2 or 3 things that you think patients need to hear that are really important for all of us to think about so that they can make their own informed decisions?
The first thing that a patient needs to hear is that this program will help with drug affordability. It will help them to be able to budget over time for their medical or their drug expenses. And that's really the most important aspect of this reform. Just to be able to, this really does take away some of the stress that some Medicare recipients have in terms of whether to buy food this month or to be able to afford prescription drugs. That's a lot of stress, and people deal with that stress all of the time. Just being able to budget for, for medicine is just alleviates a lot of stress. So that's the top message. The other message is to, I would just say, learn as much as you can about what you're getting yourself into, and just know that there is information out there, and there are people who really want to help. There are patient advocates like yourself. There are organizations like PAN who really want for our Medicare recipients to fully understand the programs and the reforms, and to be able to use these programs to, benefit themselves as best they can. But those are my two suggestions, just to learn and to just be excited about the fact that, finally affordability is in reach.
Those are great messages. When I talk about prescription costs, I always say it is such an important piece of the total cost of care for patients, but it is just a piece. And anything that we can do to lessen the financial toxicity that patients feel and face every single day, I think that's a good thing. We are seeing premiums rise, other co-pays for physician visits and other diagnostic tests. It's just a piece. So I think, as Phyllis, you just said, it is, these are important steps in the right direction. So, what can all of us do? I think as patient advocates, as I said earlier, we are all educators, and we have an obligation to make sure the people who are on Medicare, who you are seeing in your practices, in your hospitals, in your organizations, know about these reforms. So make resources available to the patients you serve. As I said earlier, we're going to have campaign materials available probably the very beginning of October, well in advance of open enrollment. And I hope that you'll all visit our website to be able to access those print resources in English and Spanish, as well as videos. But you may also have other colleagues at your hospital, team members in your practice, who also need this information. So I think you have another role in terms of educating colleagues about the reforms. This is a really important time for Medicare beneficiaries, with open enrollment just 4 or 5 weeks away. So it is a perfect time to start this education. Another message that I think you can convey to the patients you serve is that people need to take time to review their plan options. All too often we find that Medicare beneficiaries are not taking the time, and they're just sticking with their current plan because it might be the easiest thing to do, and because it may be meeting their needs. And that may be true, but I really encourage you to let your patients know that it's important for them to assess not only their financial needs, but if their plan is truly meeting their current or possible prospective prescription needs. And then finally, the PAN Foundation is working with many, many organizations and groups providing webinars on Medicare reforms, and we're happy to work with you as well on that. If that's something of interest to you, just let me know. I'll be here at the conference and happy to talk to you further about that. So with that, I think we still have time for questions, but I do want to thank Lori and Phyllis for joining me here today and providing some information that will help all of us as we begin the journey of educating the patients that we serve about the Medicare reform. So thank you. Any questions? One in the back.
If they're going to sign up for this program, it's for some people on fixed incomes, Medicare, that $166 a month is quite a bit of money, and it's more. So if they sign up, has it been talked if they're going to sign up, they should do a zero premium Part D? I mean, to me, I'm thinking of some of my people and also others that I know that are on fixed income and they have this issue. $166 when they're only getting $1,200 a month, for instance, in Social Security benefits. That's a big chunk out of it.
It is.
And
So
if
in
they
that situation, and I think I just heard someone in the back mention this, the Extra Help program, the federal program, also called Low Income Subsidy Program, may really be their best option. It's for people up to 150% of the federal poverty level and with very limited assets. It is operated by the Social Security Administration. It is a complicated application to go through, but if one qualifies for that, they will have virtually no out-of-pocket costs for their prescription medications, or really low. And in that situation, the Medicare prescription payment plan is not something they should even think about.
Hi, thank you. Over here, same area. Thank you. This is great conversation. My name is Nicole Broadhurst. I'm an independent patient advocate focusing on healthcare finance. My question is there any discussion or suggestion on educating folks in regards to the payment plan if the beneficiary chooses to change carriers mid-year?
In that situation, if they're changing plans, they will have to make sure that they have paid their outstanding balance with the plan that they're leaving. And when they move to the new plan, they have to opt in again to their plan. You're welcome.
Your talk was great. There was a class yesterday where it was brought up that potentially this change in 2025 isn't going to happen until 2026. And so it's a little bit conflicting with the information from yesterday's Medicare class. So everything you talked about is what I've been reading. So I'm just kind of curious, have you heard anything about that or not?
I'm not sure I understand what...
So with the Part D
Yep.
and the 2,000 max out of pocket,
Yep.
no donut hole, that is actually being pushed out a year.
Have not heard that.
Okay, because that was what was said in a class yesterday. So if we could try to get some clarification, that would be awesome.
I think that would be quite problematic at this late date for CMS to convey that. Any other questions that I can see? Okay, well, thank you so much for joining us, and we look forward to working with you. Take care.